Hello, everybody. Can you hear me now?
We can, yes.
Yeah,
We
probably
can't see
yes.
anything yet, but we can hear you.
Okay, because I have my camera on.
Yeah, I can see you, sorry, but I can't
Okay.
see your slides.
Can you share the screen, please?
Yeah, not prepared for that, but I will
Okay.
manage.
Yeah, I can introduce myself in the meanwhile. My name is Ioannis Amarantidis, and I'm working for region Jämtland Härjedalen in Sweden. Um, my working area is more on the Horizon grants, and I work as an expert and also as a project leader for some of our projects. So today I have prepared this session about founding for opportunities, let's say, for someone, either organization, public bodies, or private sector to, um, let's say, scale up, implement in full scale, etc., any kind of developments in digital health, e-health, and of course in m-health areas. So we can continue with the next slide um, and have a summary here. What, let's say, the most popular um frameworks, opportunities for mobile health strategies and new interventions. So we can go one by one. First slide is Horizon Europe, and you can. Okay, thank you, Sonia. Horizon Europe is a continuation from Horizon 2020. We're talking about a key founding program from European Union dedicated for research and innovation with a budget of 95.5 billion euros. Um, with missions to tackle climate change, to help achieve the United Nations sustainability goals, and boost the Europeans' competitiveness and growth. Um, we're talking about a project that wants to strengthen the impact from that has research has and innovation with implementation of new policies and tackling global challenges. Of course, through this project, it creates jobs, especially for researchers, um, and of course promotes the industrial competitiveness and investments in the European research area. You can find information about this framework on the European Commission site, and especially about opportunities, call for proposals, any kind of information that someone needs to check um, about potential um, grants through the participant portal. You can search it, you can use it, from Google search participant portal of Horizon Europe. Otherwise, I have the link here. Next slide, please. Okay, so the new period of Horizon Europe that started recently, let's say, and it will last for 7 years. We have this new structure, and we can focus more today and for our purposes in the middle part of the diagram, talking about more specifically about the pillar 2, where we have the so-called clusters that are more focused on specific areas. And cluster 1 is about health, that is of course of our interest, and also cluster 4 about the digital and industry and space, where we have a lot of ICT interventions, digitalization, etc. Um, so we are going to put more focus when we are looking for grants. I recommend that the focus should be on pillar 2 and the specific clusters. Of course, it might be some opportunities also from pillar 1, especially in the more let's say um, basic or advanced research uh, areas, and less in pillar 3. We can continue. Next slide. We have already mentioned about the budget for the next period, 2021-2027, and we see also the priorities from clusters and the budgets that will be available for this period. Just for information, um, we can continue. I can skip a little bit quicker in these slides, and of course it will be available for everyone that wants to take a deeper, let's say, view. Then we have this new instrument, the Recovery and Resilience Facility, the RRF, um, that this um, new instrument gives the opportunity to countries, to national authorities, to have a plan for, let's say, emerging stronger after the coronavirus crisis. And it gives both loans and also grants. I think close to 50-50, let's say. Um, and of course supports both investments and reforms as a comprehensive package. And also it has some goals, specific goals that the countries has to let's say reach. For example, a minimum of 37% for climate related investments and reforms, and a minimum of 20% to foster the digital transition. And when we're talking about digital, of course, any kind of, for us, m-health, e-health, etc., are under this digitalization scope. um, and also we can see on the right part of the slide that there is a specific mentioning about the health, economic, social, and institutional resilience, and any other policies for next generation. So I think that um, this new, let's say, framework, it brings some opportunities, especially for new strategies and policies, and especially for digitalization and new ICT technology. Let's go to the next slide. So from what I've seen, or probably updated before some days, I think that Hungary already requested a total of 7.2 billion euros in grants under this facility. And I think that there's still room for some kind of negotiations between the European Commission and the Hungarian government in order to get the first, let's say, pre-financing of this proposal. So there are still, let's say, some good news to wait for before this facility start and launch any kind of, uh, let's say, interventions. We can continue next with the EU for Health program 2021-2027. It's also in this new uh, period. Um, it's a very ambitious and dedicated funding program um, to ensure high level of human health protection, and to activate this One Health approach, bringing together human and animal health in the environment. This is the scope, let's say, and There are investments up to 5.3 billion euros in the following, let's say, main objectives: to improve and foster health in the Union, and there are some actions there and supporting commitments, and also to protect people in the Union from serious cross-border threats to health. Um, we can go to the next one. Next slide. Also, scope to make medicines available and affordable, and also strengthen health systems, their resilience and resource efficiency. And of course, when we're talking about health, all these um, resilience and resource efficiency, digitalization comes, of course, hand in hand with mobile health technology, I would say. So I think that through this framework, it's nice to track and see if there are any potential calls, let's say, for proposals or any um, applications available for grants. Um, we can continue with the um, next slide and the cohesion policy, 2021-2027, and more specific about the Interreg framework. We are talking about basically for a European territorial cooperation, as is better known as Interreg, and that is one of the two goals for cohesion policy, and provides a framework for the implementation of joint actions and policy exchange between national, regional, and local actors from different member states. The objective of this cooperation is to promote harmonious economic, social, and territorial development of the Union as a whole. So it's a lot of collaboration, I would say, cross-border collaboration, basically. And is built around three strands of cooperation: the cross-border, the transnational, and the international. And in next slide, we can see how this, let's say, presented in the work program. We're talking about Interreg cross-border, and Hungary participates in collaborations between Austria and Hungary, Hungary, Croatia, Romania, Hungary, Slovakia, Hungary, and Slovenia with Hungary. So there are a lot of room there for M-health policies, M-health solutions, interventions, in, of course, collaboration with neighbor countries, let's say. The other section is the transnational, where Hungary is also beneficiary to participate in the Interreg Europe and also in the um, Danube transnational program. And finally, more in the regional perspective with Interreg Europe, the Interact 3, the ESPON 2020, and URBAC 3. Hungary also, both public sector and especially regions, municipalities can participate in this kind of programs. Next slide is the, can we see, yeah, here. Thank you, Sonia. The next slide is about the national funding frameworks, more like comes from European Regional Development Fund, the ERDF. And here in this new period, we have, uh, let's say, the scope to enable investments to make Europe and its regions more competitive and smarter through innovation and support to SMEs, as well as digitalization and connectivity, greener, low carbon and resilient, more connected by enhancing mobility, more social, supporting effective and inclusive employment, education, skills, social inclusion, and equal access to healthcare, where it's very much connected with health. Um, technologies, and also to be closer to citizens, supported locally led development and sustainable urban development across EU. And of course, here we have organization that can benefit from regional funding, including public bodies, private sector organizations, SMEs, universities, associations, NGOs, etc. Um, we can continue in the next slide. Um, and here we are going to talk about the another program directly from European Commission, the Digital Europe. Um, and here we're talking about digital transition, digital transformation of systems and for Europe in general. Um, and of course, the Digital Europe program wants to accelerate recovery and drive the digital transformation. The budget is 7.5 billion euros, with um, with a focus, I would say, in artificial intelligence, in supercomputing, in cybersecurity, advanced digital skills, and ensuring a wide use of digital capacity across the economy and society. These programs also can have some calls, let's say, for proposals connected with health, connected with um, mobile health technology, etc. Of course, coupled with, as I said, the previous areas, coupled with AI, coupled with machine learning, coupled with cybersecurity, or with supercomputing, um, in order to give the, let's say, the value and the impact to society. So we have sections, as I mentioned before, supercomputing with a specific budget. We can go to the next slide. We have a specific budget allocated to more AI technology, another budget for cybersecurity, and on next slide, we have also to advance digital skills and ensuring the wide use of digital technologies across the economy and society. I would recommend to take a look on this framework also, as it has some interesting perspective for healthcare systems and for health system in general in more either national or regional context. Next slide, we we will see here the um, can you take the next slide, please, Sonia?
Even further, I am on the My Health at EU
Okay,
slide.
okay. So my
Slower, yeah.
somehow it's slower. Okay, thank you. So my health EU digital service infrastructure, I think it's the last one for my part for this presentation is a it's an infrastructure ensuring the continuity of care for European citizens while they are traveling abroad or the EU. And of course, all this has part of mobile health solutions, etc., and data security, data processing, interoperability between the systems, etc., and other also components. But two, let's say, services, cross-border health services, are already currently, let's say, uh, running, introduced in EU countries, and this is the first one, the e-prescription and e-dispensation, where e-health network guidelines on e-prescription allows EU citizens to obtain their medication in a pharmacy located in another EU country. And of course, there is a lot of transfer of data, etc., between countries. And the second one is the patient summaries. Um, also for the reason that the patient, let's say, has the historical information, his health status, all data available, that when travels, let's say, between countries, all these portfolio, I would say, of information um, goes goes together with the traveler, let's say. Um, and of course, there is an ongoing situation that uh, all this platform is going to be enriched more with medical images, with lab results, with discharge reports, as a full, let's say, EHR system across Europe. And it will be open, of course, in all European countries. And there is a goal, let's say, a vision by 2025, both services that I mentioned before to be gradually implemented in all European countries. And Hungary is there also in the list. So this is something that brings the M health also perspective into force in this infrastructure. And next slide, when we are talking about governance and financing of this, as we said, this infrastructure is a cross-border exchange of health data and patient summary and e-prescription. So the European Commission provides a common ICT infrastructure and some cross-cutting services to all European countries. And then they can set up generic services to connect national e-health systems through the national contact points for e-health. With financial assistance from Connecting Europe facility telecom program. Also, there is countries expert groups that there are managers responsible for implementing um, these settings, let's say, and nominated by the participating countries. Um, Members participate in deployment and operation of e-health cross-border infrastructure and are responsible for setting up the e-health national contact points. And finally, the operational management board is composed of representatives of internal services of the European Commission and the EHMCG chairs. Um, So this is about this mHealth EU digital service infrastructure. I think this is the last one slide of my presentation. So thank you very much for your time, and I'm available for any comments, feedback, or questions. Thank you.